Emavusertib, or formerly known as CA4948 or 4948 for us, is a drug that inhibits IRAK4. It's a reversible small molecule target. IRAK4 sits downstream from the MyD88 toll-like receptor pathway, and together with the B-cell receptor pathway, both of them converge on NF-κB, which many lymphomas are addicted to. And the thought is that by inhibiting this kinase, inhibiting this pathway, especially if in combination with the inhibition of the B-cell receptor pathway, we will be able to bypass some of the resistance to BTK inhibitors, or to achieve responses in diseases where previously we did not see responses to BTK inhibition. And we previously reported the results from the monotherapy phase 1 study, which was, of course, very preliminary and very small, with a signal of activity and a very good safety profile. The one problem with this drug, which is unique and quite intriguing, is that a small proportion of the patients will develop rhabdomyolysis quite early on in treatment. This rhabdomyolysis is in most cases just a lab finding of elevated CPK, even though some patients will present with like a grade 1 pain in their muscles. It's usually transient. You hold the drug, you give fluids, and they improve. We try to hold statins and other drugs that might be associated with myopathy. But beyond that, treatment has been quite easy. It's an oral therapy. And in this current year, we presented the phase 1 portion of the first 13 patients treated with the combination of Ibrutinib together with the IRAK4 inhibitor. About half of them were previously exposed to Ibrutinib, and the other half have not been exposed. We have seen among the first 9 evaluable patients about 2 PRs, 2 CRs, and a few stable diseases. One of the stable diseases was still stable 8 months in, with a very manageable safety profile. In the same EHA, they also presented the results of the IRAK4 inhibitor of CA4948 in AML and MDS. And there we are seeing an interesting phenomenon. It was a larger study with 49 patients, but a subset of the patients had spliceosome mutations. And it seems that these spliceosome mutations create a subtype or an isoform of IRAK4, which is more sensitive to this inhibitor. And in that subgroup, they saw quite impressive, very early phase responses.